We are launching a massive campaign to mobilize all South Africans to get tested for HIV. Every South African should know his or her HIV status.
In April 2010, then South African President Jacob Zuma said the words scientists, activists and those living with HIV/AIDS in the country had been waiting to hear for years.
All pregnant HIV-positive women with CD4 count of 350 or with symptoms, regardless of the CD4 count, will have access to treatment.
It was a dramatic turnaround for South Africa, which was at the epicenter of the deadly AIDS pandemic. At the time, the country had the highest number of people living with HIV in the world. Zuma's predecessor, Thabo Mbeki, made international headlines in 2000 when he began casting doubt over whether HIV causes AIDS.
You see, when you ask the question, does HIV cause AIDS? The question is, does a virus cause a syndrome? How does a virus cause a syndrome? It can't.
For nearly a decade, President Mbeki questioned AIDS statistics, the efficacy of antiretroviral drugs, saying they were toxic, and suggested poverty and poor nutrition caused AIDS. In the face of about 1,000 AIDS-related deaths a day in South Africa, then Health Minister Mantu Shabalala Msimang promoted a concoction of alcoholic drinks, fruits and vegetables to treat HIV. Mbeki restricted the use of drug therapies like nevirapine and withdrew government support for clinics administering AZT to prevent mother-to-child transmission of HIV. South Africa's AIDS drugs dispute triggered international condemnation, nationwide protests, and overshadowed the country's first national AIDS conference in Durban in 2003.
People were dying of HIV and no one was taking responsibility, and we were told to eat garlic and all those things.
Sibongile Chabalala is an activist with South Africa's Treatment Action Campaign. She contracted HIV more than 20 years ago. She says South Africa has come a long way since those difficult years. Today, people like her are able to live with HIV/AIDS instead of dying from it.
I was diagnosed with HIV in 2000 and started ARVs in 2006. And in 2008, I had my second born. My third born was born in 2011, of which both of my children are HIV negative. Some of us wouldn't be here if it wasn't for ARVs.
Critics say Mbeki's handling of the AIDS crisis caused more than 300,000 preventable deaths. For Shabalala, South Africa's experience underscored the dangers of science denialism and politicizing public health.
What is important is to save people's lives before pushing our own ideology. When COVID came, it was affecting everyone, but we've seen countries like South Africa and India challenging other countries to say we need to save people's lives. That's a kind of politics that we want to see, where when we engage early on the issues of health, then we are able to save more lives.